Say go.
Go.
Very good.
So now we're gonna move on to your cage. Alrighty, first thing to point out is a separate standalone piece behind the mandible. Sorry, his mandible's kind of messed up. Hyoid bone. That's it, so you need to know right there. Hyoid bone. Right? Cool. Now moving lower. Broke his jaw. Alright. Moving lower, you have your sternum. Right. You have the manubrium of the sternum. See how there's like a distinct line right there? Right? Focus here on your body. Then you have the body of the sternum. Right? See how there's like a line there and a line there? That's your body. So manubrium, body, xiphoid process. Right? It's just that little triangle, upside down triangle right there.
And that is XIPHOID process. It's difficult.
Alrighty, so now we have your ribs, which you have 7 true ribs. So starting up here, you got 1, 2, 3, 4, 5, 6, 7. Right? So here to there, those are your true ribs. Right? They're called true ribs because they have cartilage that directly connects to that sternum. You have 8, 9, and 10, which are called false ribs because 8, 9, and 10, their cartilage connects first to that bottom cartilage of that 7th rib and then connects to the sternum. That's why they're called false ribs, because they're not directly attached themselves. So then you come down here and you have 11 and 12, your floating ribs. They're not connected at all with cartilage. They're just kind of hanging out back there. Right? Nice and easy. So now, put it back up. Another thing you need to know on this front side is that this is your clavicle. Right? The clavicle comes over here, and this is your scapula. Scapula, you need to know a few more things than just that it's the scapula. Scapula, right? This is a left scapula. The way you can tell if it's left or right is the border needs to be facing medially. Spinous process needs to be facing posteriorly. And the glenoid fossa needs to be facing laterally. Right, so knowing all that, 1, 2, and 3, you know that this has got to be facing like this. So this has to be the left side. Right? So on the scapula, you have your, see if I can remember. Yep. You have your acromion process. Your acromion process. And then you have your coronoid process. Right, it's this protrusion. So acromion process, coronoid process.
It's almost like
Right?
this.
You have that glenoid cavity. You have your scapular spine. Runs along there, scapular spine. Then you use that scapular spine to know the 2 locations of the 2 next things. You have your supraspinous fossa. Right, above that spine, supraspinous fossa. And then below that spine, infraspinous fossa. Right? So, supra, infra, spinous process, or fossa. Excuse me. And then you have your subscapular fossa. Right? This is space for your subscapularis. So now we're going to go to the humerus. The humerus, you can tell if it's right or left based off of 2 things. 1, the head. 2, the olecranon fossa. The olecranon fossa needs to face posterior, and the head needs to face medially. So we know that this has to face like that because the olecranon fossa is going backwards, and this is going to the inside, right? So we know that that's a left one. So that is going to be a left one.
The left, right.
Yep.
And how do you tell the olecranon process and the coronoid again?
I'll tell that in a second. I'm gonna.
Oh, so that was
Not just yet. No, you're fine. So you have your head, and then just the base of the head is your anatomical neck. Right? See how it kind of smooths out? Anatomical head. Then you have on the lateral side of the bone, right? right? So it's going to be this side of that bone, because that's lateral to the outside, is going to be, see how it gets kind of rough right here? That's your deltoid tuberosity. It's where your deltoid muscle inserts at. Right. So now you have your greater and lesser tubercle, and that you can kind of base on size. Greater tubercle, lesser tubercle. See how it's kind of smaller and a little bit lower, or a little bit more distal. Right. That's how you can know. Greater, lesser tubercle into tubercular sulcus. Yeah, groove sulcus, same difference. They mean the same thing, literally. Alright, and then you come down here, and you have your condyles. We need to learn about epicondyles. You have your condyles and your epicondyles. So condyles are going to be a little bit more inside. So, these are your condyles. You have your medial condyle, because remember, it's towards the medial side, so medial condyle, and then the lateral condyle. You can also call it your capitulum or your trochlea. And the reason I mention that is it becomes into play a little bit later, right? So just keep that in mind. Trochlea, capitulum, medial condyle, lateral condyle. Then you have your medial epicondyle and lateral epicondyle, right? So condyles then just come outside, epicondyles. You have your olecranon fossa, as we talked about, on the posterior side. That comes into play again later. And your coronoid fossa, again, comes back into play later. Moving on to the radius and ulna, your two bones of your forearm. Right? You can see that they fit together. I'm not going to get this magically together right now because it's too much willpower. So we know that this is your ulna because it's got a U. U for ulna. Easy to remember. Radius. The way you can remember that this is your thumb side of the forearm is the radius turns up the radio. Right? It's on the thumb side. This is your pinky side. The way I remember that is it's smaller, right? Small like your pinky. Big like your thumb, small like your pinky. So, talking about the radius, you have the head of the radius, right? It's just that rounded area, right? The head. And then you come down where it kind of dips in. That's the neck area, right? So I'm holding it by its neck. Then you have your radial tuberosity. Tuberosity tends to mean just a protrusion of the bone. Right, radial tuberosity. Come all the way down here, you have your styloid process of the radius, right? Just like up here, with the stylus process, how they have a fine point up there, these are going to have a fine point down here. Now onto your ulna. Remember how I said the olecranon and coronoid fossa would come back into play? That's how you're going to remember which is which here. The olecranon fossa, or the olecranon process, and then the coronoid process, right? So, if you come back to the humerus, the ulna is what articulates with the humerus the most, right? So you have your coronoid process going into that coronoid fossa, and then when you extend out, you have that olecranon process going into the olecranon fossa. Nice and easy to remember, right? And again, before, like I mentioned, you had to remember that trochlea, that medial condyle, because this is what articulates with it. This is the trochlear notch. So this articulates with the trochlea, or the medial condyle, right? And then you just need to remember that up here, there's a little flat part, the radial notch, because that's where the head of the radius will sit. Not like that, it will sit properly, obviously. And then you have your styloid process down here. Okay? Then, coming down to the hand, the hand, you have your carpal bones. You just need to know that these are your carpal bones, which are an example of short bones, right? Remember that? And then we have that. Then you have your metacarpals, right? So you have your carpals, which are these tiny little bones right here in your hand, your wrist. Then the first long bones of that area are the metacarpals. And then you come up here after the knuckles, right? The first knuckles. You have your phalanges, right? The number goes 1, 2, 3, 4, 5. Always thumb to pinky side. 1 is only going to have, your thumb is only going to have your proximal and distal, right? Distal phalanges. Whereas 2 through 5, your index finger to your pinky finger, you're going to have proximal, middle, and distal phalange. Okay? Nice and easy? Cool. So now, so where is the